Hi, I'm Sarah, Quality and Education Nurse with Fairview Home Infusion. In today's video, we will be discussing infection control practices in the home environment. In this video, it will be broken down into multiple different scenarios. You will see that there will be improper technique, followed by a review of the proper technique on infection control practices in the home. Please watch closely and see how many improper techniques you can pick out at each scenario. Hi, I'm Sarah from Fairview Home Infusion. I'm your nurse today.
Hi.
Are my shoes okay to be on?
I'd like you to take them off.
Okay. On the first take of the scenario and entering the home, you'll notice that I removed my shoes and placed my bag on the floor and another bag on the upholstery. On the second take, I asked my patient whether she would like me to cover my shoes with a shoe cover or if they were okay to be left on. You notice that I also placed my bags on a hard, clean surface. If a clean, hard surface was not available, I would have placed my bag on a barrier. The staff bag should be broken down into two different compartments. One compartment should be broken out into your single-use items, such as wound care supplies, your dressing change kits, the items that you use to provide the care to the patient that will not be reused. The other side of your bag, or the other compartment, should be your reusable supplies, such as your blood pressure cuff, your thermometer, things of that nature that are reusable. Items that are unable to be cleaned from the patient environment, such as paperwork that we have our patients sign, reusable pumps, infusion pumps, that the patient has used, those items should not be placed back in the bag, along with sharps containers. Sharps containers may be carried separately or on an outside pocket of the bag. Remember, if the home environment is unsanitary, bring only the items you need to provide the care. Always refer to the policies or your supervisor if you have questions. Hand hygiene is the most effective way that we can prevent infection. Please watch this take and count the number of opportunities to correct the hand hygiene technique. Did you notice my incorrect use of bar soap, my hands to turn off the faucet, and the towel lying by the sink to dry my hands? Hand sanitizer is a preferred antiseptic following the worldhealth.org guidelines. In these situations where hand soap is recommended, nurses should use liquid hand soap and paper towels provided. Bar soap is not acceptable to be used. Liquid hand soap should be used with friction and scrubbing motion for a minimum of 15 seconds. Some common places that are missed during performing hand hygiene are in between your fingers, your thumbs, and your fingertips. Please watch this next take of proper use of hand sanitizer and hand hygiene technique, as well as patient education. The first thing that we want to do is perform hand hygiene. You want to make sure that you cover all surfaces of your hand and interlock your fingers. You don't want to wave it, you want it to dry naturally. We also have this nice patient education tool that goes over when to use soap and water, how to use the soap and water, and then on the back page it does discuss using alcohol-based hand rub. Proper storage of supplies is important for the safety of the medication as well as infection prevention. Be sure to observe storage methods in the home and educate patients in the proper methods. Watch the next take and think of how the storage could be improved. Did you notice the incorrect storage under the sink by a plunger and the baseboard heating? An environment like this could potentially cause harmful growth of microorganisms and change the drug stability. Patient education should include items that are marked for refrigeration must be kept cold in a clean refrigerator. Storage of all medicines should be kept away from direct sunlight or moisture. Keep medications out of reach of children and pets, and keep supplies in a clean area. Now let's watch the next take of proper patient interactions about the storage of supplies. Can you tell me about how you're storing your supplies?
I've been storing them in the kitchen under the sink.
Okay. Well, it would be best if you stored it in a clean, dry area away from children and pets. To do this, either your dining room or in your back bedroom would be great.
Okay, I have a shelf in my closet I can put them on.
Perfect. That will work out great. This next take goes over the improper practices of hand hygiene, supply usage during patient care, aseptic technique and application of antiseptic. Once again, try and count how many improper practices you can pick out. Remember the 5 moments of hand hygiene. These include before touching a patient, before performing clean or aseptic procedures, after exposure to body fluids, which include removing your gloves, after touching the patient, or after touching the patient's surroundings. You always want to assess your environment before touching objects. I'll talk more about that after playing this next take. I see that you're due for your line care and lamps today. Are those your supplies over there?
Yes, they are.
All right. This is all I need.
Okay.
Did you catch that I stored my gloves in my sweatshirt pocket along with my pen?
All right.
We can get started.
Great.
Were you able to catch that I missed these opportunities for hand hygiene? Before I set up my supplies and field, before putting on my clean gloves, after removing my clean gloves, and before I placed my sterile gloves on. Stay alert to every opportunity to properly perform hand hygiene. Now, as part of being alert and assessing your environment, look for items that cannot be wiped down with a disinfecting wipe after use, or items that are dirty. You do not want patient supplies touching an object that cannot be cleaned. For example, a computer without a keyboard cover or the bottom of the computer. These cannot readily be cleaned. When performing a procedure requires antiseptic, it's important to know how the antiseptic works. In the take you just observed, you should have noticed I cleaned the exit site for only a couple seconds. This was incorrect. Always follow the guidelines for correct application. Chlorhexidine needs to be applied using friction and scrubbing motion using back and forth techniques for a minimum of 30 seconds. The reason why you do back and forth techniques is to ensure that you are getting in between the skin cells where they overlap. So back and forth, 30 seconds minimum. And this should go anywhere where that dressing will lie. Alcohol and povidone iodine, on the other hand, requires alcohol to be placed at the site first using friction for a minimum of 1 minute, followed by povidone iodine. Povidone iodine is applied in concentric circles from the exit site out. These come in a packet with 3 swab sticks to each one and are not supplied in our kit. Okay, next we'll take a look at proper techniques for hand hygiene and setting up supplies for patient care. I see that you need line care and labs today.
I do.
Perfect. I'm just going to get everything set up. In the second take, you also should have identified that I placed my gloves in the appropriate storage container, which was in a Ziploc bag inside my bag. When I opened my bag, I took all the supplies that I would have needed for that visit out at one time to limit the amount of times that I enter into the bag. Are those your supplies?
They are. Do you need them?
Yes. I do not need the rest. They can go back over. Some examples of hand hygiene at the appropriate interval would be before I entered into my bag, after removing my gloves, and before direct patient care. Always remember to assess your environment around you before touching objects. And always remember the 5 moments of hand hygiene. Our next demonstration topic is about equipment storage and handling. Watch closely to observe improper methods of handling equipment. Remember to watch for hand hygiene opportunities too. Now that we're done with your lab job, we will get you connected to your medication. Those could be thrown in the garbage. And those you could put in your supplies.
Do you think you could take this for me? It's full and I don't have the box that it goes in.
Absolutely.
Thank you.
Thank you. Well, thank you very much, and it was very nice to meet you, and you have a great rest of your day.
Thank you.
In the last take, you saw me cleaning the equipment with the wrong product. An alcohol wipe is not appropriate for equipment disinfection. In addition, I did not allow it to dry properly before placing it in my bag. Always make sure that you are applying your agency-approved disinfectant, such as Sani-Wipe. Anytime you use a disinfectant, it should be allowed to air dry before it is placed into the bag. So before I access into a patient's line, I would perform hand hygiene, apply my gloves, and scrub the needleless connector. Now, when we are talking about scrubbing the needleless connector, you want to remove your alcohol pad, place it on the top, and scrub for 15 seconds minimum with friction and scrubbing motion. You do want to include the threads, but your main focus should be on that top surface of that needleless connector. Now let's watch this next take to see how it should be done. Give me a minute and I am going to get my equipment cleaned up, and then I'll get you connected to your pump again.
Sounds good.
Plans for this weekend?
I will have to see how I'm feeling, because I might not be feeling that good.
Understandable.
How about you?
No plans.
I hope I'm feeling better soon.
I do too. This has been going on for a while for you.
I know.
All right, let's get you connected here. We just have to allow it to dry in between.
I try to remember to do that too.
It's hard. It takes time. You are all set to go.
I'm good now.
You are good.
Thank you.
In your sharps container?
Oh yeah, I was gonna ask you if you wouldn't mind taking this for me because it's full and they sent me a new one, but I didn't get a chance to return this one yet. Can you take it?
Yes. Do you have an extra bag we could put it in?
I think so. Here's one.
Thank you. I'm just gonna gather my equipment and then I will be on my way. Do you have any other questions?
I don't. Thank you so much.
Infection prevention can become a good habit when you observe proper techniques during every instance of patient care. Stay alert to ways that you can prevent infection, even when outside the home at your vehicle. This next take will demonstrate common mistakes when transporting patient supplies. As shown here, both clean and dirty supplies have been allowed to scatter inside the car, creating a contaminated environment. A used sharps container should always be sealed shut and placed in the designated side for contaminated supplies. Do not stow your bag on the floor of the vehicle. There are simple ways to prevent infection around your vehicle. This next take shows the proper way to transport patient supplies. That you do need to have two separate containers, one for your clean, one for your dirty, and they need to be enclosed. Your bag should always be placed on a seat or on a barrier. They should never be placed directly onto the floor. Preventing infections while caring for patients in the home keeps you safe, as well as your patients. Thank you for watching these scenarios to help you remember best practices. Always refer to our policies at www.fairview.org and ask your manager or supervisor if you have any questions. Thank you for watching.